Good morning, guys. Tony Maritato here, licensed physical therapist. So I want to answer a message that came in through one of our Facebook groups. It said he's 7 weeks post-op, left total knee replacement. He's been doing great, increasing range of motion, flexion and extension, but in the last week, he's been having significant increases in pain, mainly behind the knee in the tendons. I'm assuming the hamstring tendons. Mid-bend seems to be where the pain hits the most. I'm not sure if I should contact the surgeon or not. My response to that was to indicate that that might be totally normal. If he's at the 7-week mark, he's probably increasing his activity levels. He's probably developing a little bit of tendonitis or tendinopathy in the hamstring tendons. The hamstring muscle is the muscle behind the leg that pulls your knee into flexion. So since the knee probably isn't at full flexion yet, he's still working hard to pull it back into flexion using those muscles. Those muscles are probably weak from prior to surgery, and it's just developing a little bit of an overuse situation. So then after I made that comment, he also replied. I said, thanks for the comment. I've been walking about twice a day for a total of 4 to 5 miles. Daily. That's a lot. At 7 weeks post-op, 4 to 5 miles a day, even breaking it up into 2 sessions, that is a lot of walking. It's awesome. It's amazing. I would high five you if I could, but that's a lot of walking. So he said, been doing that for about a month. My range of motion has dramatically increased in the past 2 to 3 weeks. This definitely feels like tendon pain and at the anterior back of the knee. Sleep has gotten very difficult, as well as getting up and down. So again, I've never evaluated you. I have no idea I can't give you any kind of medical advice, but I can reasonably say, you're doing a ton of activity. You're early in the recovery process, 7 weeks post-op. If you've been doing that volume of activity, 4 to 5 miles a day, multiple days a week, you're probably developing a little bit of tendonitis, tendinopathy. What I would recommend is mixing up what it is that you're doing, finding a way to kind of take some of the workload off of the posterior hamstrings, let your body, work in other areas. So talk to your physical therapist. I imagine you're still in physical therapy at 7 weeks post-op. See if you can create a program that gives you a chance to vary the workload so it's not quite so much volume, and potentially even just look at taking a couple days of rest. I'm a huge advocate of resting. Somebody who's doing that level of activity, certainly resting probably more than the typical person for recovery is important. I would look at, you had mentioned you're having challenges with sleep because of the pain. We know that impaired sleep, disrupted sleep also slows down the healing process and the recovery. I would look at your nutrition. If there's anything you can do to improve the quality of your nutrition. Maybe you're not even getting enough calories. I see a lot of patients who, following surgery, they're doing so much more activity, but they're not adequately compensating with fueling the activities that they're doing. So a lot of times I'll talk to patients about increasing their activity, maybe adding an extra meal throughout the day of high quality, nutrient-rich food. I'm not giving any recommendations on what exactly you should eat, but the idea is that if you're doing, 400 to 500 extra calories a day in activity plus the recovery of that, you might not be consuming enough to fuel the activity level that you need. Bottom line is, it sounds like a recovery problem more than a mechanical problem with the knee. And I just think, talk to your physical therapist, potentially reach out to your surgeon, look at some things that could help support your recovery between workouts, between sessions. But all in all, you're doing amazing. I congratulate you, and I wish you the best.